The job description of an intake coordinator involves managing the initial intake process for clients, patients, or service users in organizations such as healthcare facilities, social services, educational institutions, or nonprofits. Intake coordinators serve as the first point of contact, ensuring that client information is accurately collected, verified, and routed to the appropriate departments or professionals. Their role is crucial in establishing a smooth and efficient intake process that supports effective service delivery and client satisfaction. Intake coordinators are often responsible for assessing eligibility, documenting client needs, and coordinating appointments or services. They work closely with administrative staff, case managers, and other professionals to ensure that information flows accurately and securely through the organization. By managing the intake process efficiently, intake coordinators help organizations provide timely, accurate, and personalized support to their clients or patients. Most intake coordinator roles are permanent, though some may be project-based depending on the organization. The position requires strong organizational skills, attention to detail, and the ability to communicate clearly with diverse populations. Success in this role depends on the ability to handle multiple tasks simultaneously, maintain confidentiality, and adapt to evolving client and organizational needs. Primary responsibilities of an intake coordinator. Intake coordinators have a variety of responsibilities that ensure the smooth operation of the intake process. One of their primary duties is to gather and verify client information. This includes obtaining personal details, medical or service histories, and documentation required for eligibility or compliance purposes. Accuracy is paramount, as errors in intake information can disrupt service delivery and impact client outcomes. Scheduling and coordinating appointments is another central responsibility. Intake coordinators must ensure that clients are assigned to the appropriate professionals or services in a timely manner. This requires balancing multiple schedules, managing cancellations or rescheduling, and maintaining clear communication with clients and staff. Another critical aspect of the role is assessing client needs. Intake coordinators may conduct preliminary screenings, review documentation, or ask targeted questions to determine service eligibility and prioritize needs. They must follow organizational policies and procedures while demonstrating empathy, professionalism, and cultural sensitivity. Data entry and record maintenance are essential tasks. Intake coordinators input client information into electronic databases or paper records, ensuring that all data is complete, accurate, and up to date. They also generate reports for supervisors or regulatory compliance, track service metrics, and identify potential gaps or issues in the intake process. Communication is key. Intake coordinators serve as the first point of contact for clients, answering inquiries, explaining services, and providing guidance. They must be able to explain complex processes clearly, address client concerns professionally, and build trust to ensure a positive client experience. Midway through this discussion, it becomes evident that the job description of an intake coordinator is more than administrative work. It is about facilitating smooth client experiences, ensuring data integrity, and acting as a liaison between clients and service providers to support organizational goals. Essential skills and qualities for the role. Intake coordinators require a mix of soft and technical skills to succeed. Communication skills are fundamental. They must be able to speak clearly, listen attentively, and convey information effectively to clients, staff, and management. The ability to manage sensitive conversations with empathy and professionalism is particularly important in healthcare or social services settings. Attention to detail is critical. Intake coordinators handle confidential information, complete forms, and record client data. Mistakes can lead to delays, miscommunication, or compliance issues. Therefore, meticulous data entry, thorough document review, and consistent follow-up are necessary skills. Organizational skills are essential. Intake coordinators manage multiple client cases, appointments, and administrative tasks simultaneously. They must prioritize workloads, maintain accurate records, and ensure that each client receives timely and appropriate attention. Problem-solving abilities are important in managing unexpected challenges. Intake coordinators may encounter incomplete documentation, last-minute schedule changes, or clients in distress. The ability to remain calm, assess the situation, and implement practical solutions is a key asset. Technical proficiency is increasingly required. Many organizations use electronic health records, EHR, or client management systems, scheduling software, and digital communication platforms. Intake coordinators should be comfortable learning new tools and maintaining accurate digital records. Professionalism, reliability, and discretion are non-negotiable. Intake coordinators often handle sensitive personal or medical information, and maintaining confidentiality is critical. They must adhere to organizational policies, regulatory standards, and ethical guidelines while demonstrating accountability and dependability. Cultural competence enhances the effectiveness of an intake coordinator. Clients may come from diverse backgrounds with different languages, beliefs, or experiences. Understanding and respecting these differences ensures smoother interactions and more effective service delivery. Work environment and challenges. Intake coordinators work in a variety of environments, including hospitals, clinics, social service agencies, educational institutions, or nonprofit organizations. They typically operate in office settings but may also interact directly with clients in waiting areas, reception desks, or via telephone and online platforms. The role can be demanding, requiring multitasking and attention to detail under tight timelines. Intake coordinators often manage high volumes of client interactions while ensuring accuracy, professionalism, and adherence to organizational policies. They may face emotionally challenging situations, particularly when working with vulnerable populations, requiring patience, empathy, and resilience. Despite these challenges, the role is rewarding. Intake coordinators help clients navigate complex systems, gain access to needed services, and have positive initial experiences with an organization. Their work directly impacts client satisfaction, operational efficiency, and the overall reputation of the organization. Compensation varies depending on the sector, location, and experience level, often including a competitive salary, benefits, and professional development opportunities. Successful intake coordinators may advance into supervisory or management roles, overseeing intake teams or broader administrative functions. Educational requirements and training. Most intake coordinator roles require a high school diploma, though many employers prefer candidates with an associate or bachelor's degree in healthcare administration, social work, psychology, or a related field. Experience in customer service, administrative support, or client coordination is highly valued. Training is provided to ensure intake coordinators understand organizational procedures, documentation requirements, software systems, and confidentiality protocols. Many organizations also provide ongoing professional development to enhance communication, client engagement, and technical skills. Specialized certifications in medical records management, case management, or administrative procedures can improve career prospects. Conclusion. The job description of an intake coordinator highlights a position that combines administrative precision with client-centered interaction. Intake coordinators serve as the first point of contact, ensuring accurate information collection, smooth appointment coordination, and effective communication between clients and service providers. For individuals who are organized, detail-oriented, and skilled at interacting with diverse populations, this role offers both professional growth and the opportunity to make a meaningful impact. Whether in healthcare, social services, or educational settings, intake coordinators play a crucial role in facilitating access, supporting clients, and contributing to the overall success of the organization.